Hi everyone, my name is Alice Pena and I am creating my debate video for my Introduction to Social Work class on the topic of physician-assisted suicide. The debate question is as follows. Should physician-assisted suicide be legal for patients who have less than 6 months to live? What about patients who have debilitating chronic pain or other conditions that may not be terminal but have destroyed their quality of life? Some of these terminal illnesses can range from cancer to ALS to anything that has decreased the patient's ability to live a fulfilling life. So what is physician-assisted suicide? This is whenever a physician or a doctor facilitates a patient's death by providing the necessary means or information that basically enable the patient to perform the life-ending act. So usually the doctor will prescribe the patient a lethal dose of medication for them to take, and the patient will take the medication, thus ending their own life. Usually, patients who look into physician-assisted suicide are terminally ill patients, and many of them look into this option because it is the best means for them to end the pain caused by an illness that no drug or interventions can cure. This topic has caused a lot of controversy in the medical field, in the religious field as well, because many argue that it should not be legal, but many also believe that it should be allowed. Some are against it because of religious and moral reasons, and they believe that it is disrespectful to take away a life. Some even go as far as to say that the person performing the procedure or giving the medication to the patient is committing murder. Or they'll say that the individual is committing suicide because they're not dying in a natural way, or they're not dying a natural death. A lot of people, though, support it and are for it because of their compassion and respect for the dying. They believe that no individual should have to suffer through so much pain because they already have a terminally ill disease. So they understand that, at the end of the day, this disease is going to cause their death, but they shouldn't have to suffer through it. Personally, I believe that the patient should have the right to choose whether or not they want to participate in physician-assisted suicide. I believe this due to the fact that many individuals who are choosing to look into this option are only looking at this option because they have no other choice. They've accepted the conditions and they're aware of what it means, and it's the only way to relieve them of any suffering that they might be experiencing. The right to physician-assisted suicide would give the patient the right and ability to leave the world with dignity, and it would save their families from any financial cost of having to keep up with the terminal illness, and it can give them relief from unbearable pain. While there are some speculations that people should not be given this right because they might not need it, or some people argue that those people with terminal illnesses suffer from undiagnosed depression or other mental illnesses that can impair their ability to make an informed decision. I believe that there should be certain standards that one must meet in order to have this done. So there should be psych evaluations to make sure that the person is capable of making these decisions, and there should be a time frame of certain time that gives them the opportunity to change their mind if they would like. Many doctors are also against the idea of physician-assisted suicide because of the oath that they took whenever they began practicing that states that they'll only work for good and won't cause any harm to the patient. However, other physicians also argue that the patients, have grown accustomed to making their own health decisions throughout their life and they should be allowed to control the circumstances of their deaths. Currently, there are 10 states that allow physician-assisted suicide, and there are many more states that are currently looking to pass laws in order to have it legalized in their states as well. I believe that terminally ill patients should have the opportunity to decide how they would like to live their last moments. However, I also believe that there should be certain standards that are set in place to just really make sure that those who are considering it are in a good state of mind and they're not doing it for, other reasons. And actually, there have been new laws set in place that support this same way of thinking. So now, in order to have a prescription to receive a lethal dose of medication or to even consider physician-assisted suicide, the candidate must have certain steps fulfilled, such as they need to have 2 oral requests to the physician separated by at least 15 days, a written request signed in the presence of 2 witnesses, confirmation of diagnosis and prognosis, and a confirmation of competency by both the prescribing physicians. I believe that with these standards and rules, patients are able to rightfully they're going to be able to rightfully decide the matters in terms of their own death in a respectful and dignified way. And I believe that the patient's autonomy should be respected.